Welcome to the Rational Egoist. I'm your host, Michael Liebowitz. Today's guest is the managing editor at feed.org, and he's also written for publications such as Forbes, the Wall Street Journal, and Time Magazine. Jonathan Miltimore, welcome to the show.
Hey, Michael, how you doing? Thanks for having me on.
I'm doing fantastic and glad to have you. So what brought you to my attention was I read an article that you wrote about Sweden's approach to the coronavirus when it first hit, and how they compared to other countries in terms of fatalities and infections and whatnot. So what exactly was Sweden's approach to this thing?
Yeah, I've been writing about Sweden for, at least 3 years now in its pandemic policy. And if you go back to late March or early April of 2020, I had an article, just asking, could Sweden's laissez-faire approach to the coronavirus actually work? And when I say laissez-faire, so Sweden was a country, it took an approach, it didn't lock down in 2020. Now, there are other countries that had kind of, less aggressive, some would say tyrannical approaches to COVID mitigations. But Sweden, did they have some restrictions? Like there were some, but they never shut down. They never closed schools. They never closed, restaurants and businesses. They did have some capacity restrictions, on you couldn't have crowds of hundreds of people or, things like that. But society stayed pretty normal. And if you look back, people thought Sweden, they're losing their mind, because if you remember how frightened people were in March 2020, in April 2020, you had all these articles written that, in my article, I cite a New York Times story saying the New York Times said, Sweden is the cautionary tale, and they're saying they're going to get all these people killed. And you can find dozens of articles with headlines like that, and the whole time I was watching, I'm like, well, Sweden's numbers aren't very different than these other countries. And if you look, you compare them to modelers, the people who are, to step back a little bit and to understand why nations went into lockdown, right? Like at first that wasn't going to happen. And then China went into this very, very strict lockdown, and people started to think, well, if China's doing it, maybe we should do it. People started to get frightened when they saw some of the numbers coming out of Europe. And there was a change in policy that said, okay, maybe, what we need to do is just shut everything down. And, if you try to open your business, you're going to be arrested. That approach always seemed a little crazy to me. And it was different than anything that had been tried before in the previous century during pandemics. We had other pandemics. And so Sweden did try to, this other approach. But again, it was tried because modelers predicted 40 million people would die by the end of the year if we didn't take these lockdown this approach. And Sweden, like modelers projected Sweden when they were, kind of flirting with not shutting down. They said Sweden would have close to 100,000 deaths by the end of the year. So we're talking about a period of 8 or 9 months. Sweden didn't lock down. That didn't happen. So Sweden, like every other country, people died of the coronavirus, right? It's a deadly virus going around. And, especially we saw different strains that was really highly contagious. But the modelers were astronomically wrong in their projections. So 3 years later, I'm giving you the short version, but 3 years later, we have, a lot of data now. And there's different data sets depending on what you look at. There's some, like Sweden's government has its own numbers that show like its country's excess mortality is the best in all of Europe. And these numbers have kind of been making the rounds on social media. And they show like excess mortality in Sweden in 2020, 2021, 2022 is about 3%, 3.5%. And that's much, much lower than other countries. The New York Times, an article I kind of read about, they have some problems with those numbers. They don't think that they factor in, they're not adjusted for age and some other things. But the author of the article, David Wallace Wells, who's a Pulitzer Prize winning journalist, does concede like Sweden's policy was not a disaster. He says it was very average, right? They didn't do all these things that were supposed to protect people, and yet it's COVID mortality was much lower than countries like UK, France, Germany, Italy, all these other countries that had very strict lockdowns. And I think it's important that we not just move on to the next crisis, right? I think we need to really learn some of the lessons of this pandemic. And I think we do need to look back and take a careful look at what Sweden did and say, wow, you know what? They really did get this pandemic mostly right. And that's there is a quote in the New York Times article. Again, this is the Times who was really excoriating Sweden in 2020, 2021, where they said the biggest lesson from this is that we don't need to use, or we can largely forgo these really coercive policies. And that's what this was really about. We saw public health agencies shift from, for years, public health agency, their job was to make recommendations, right? Like they said, okay, hey, here's what we recommend. We saw a shift and said they weren't just recommending, they were advocating for us. They wanted to shut all these things down. And we weren't just going to recommend a mask. If you didn't wear a mask, we could arrest you, or we could shut down your business. Those are things that, I think, looking back, this is the kind of approach I think we really need to be careful about, because it really it did politicize this pandemic in a way it never should have been. And you look at Dr. Fauci, he was always people are politicizing this. No, he politicized this. Once you start to take public health and say, we're not making recommendations anymore. If you don't do what we say, we're going to take your livelihood. We might take your freedom. And I think that's why we went through this period of 2-3 years that was utter madness.
So I agree with you 100% about lockdowns. I take a bit of a different approach because I'm not a consequentialist. I come from the individual rights perspective, and I just don't think the government ought to be telling people how they live their lives. So let me just be clear about that. I'm not a guy for lockdowns, but there are some objections or explanations also to the case you just laid out. So I'd like to go over a few points with you.
Sure.
First, some people might say, okay, it's true that Sweden was basically in the middle of the pack as far as fatalities and infection rates and whatnot comparative to Europe. But they'll say that that's not the proper point of comparison. The proper point of comparison would be the other Nordic countries, the countries that surround it. And those countries, from what I could gather, had far less fatality rates, far lower fatality rates than did Sweden. So what is that a adequate description of events? Is that a good critique of the sort of defense of Sweden? How would you respond to that?
Yeah, no, you bring up a point that a lot of people bring up, right? And I've been writing about that, for at least a couple of years too. And David Wallace Wells mentions this in his article as well. So you bring up something that's common to the, when we come up with these debates about Sweden's policy. And here's what people don't realize: Sweden did become like this focal point, right? The laissez-faire country that didn't lock down at all, because, like I said, they never took a let it rip approach. They had some, modest restrictions and so forth. What people don't realize is that they roll out Finland and Norway. Like, look, they even did it better. They don't realize that Finland and Norway had policies less restrictive than Sweden for months and months and months in 2020. And again, this isn't me saying, I haven't written about it, but David Wallace Wells makes this point in the article as well. And we have this data set from Oxford University, and it's the COVID Stringency Index. And people can Google it and they can find it. And you can compare countries based on how aggressive their governments, had COVID policies. And you'll see Finland and Norway somewhere about the summer after these countries went into lockdown for a little bit, but then they quickly eased up, and they had policies that were very laissez-faire, right? That were actually less restrictive than Sweden. And people, you could argue, hey, well, sure, the numbers are better. Was it because they were less restrictive than Sweden, or was it because they locked down there for a few weeks back in? Those are fair points. I don't think anybody will really have a good answer on that question. But I think that the biggest lesson in what I'm saying is this: Finland and Norway were not these states that took aggressive approaches to COVID. Okay, they were much closer to Sweden than the UK or Germany or the United States. Again, I'd encourage any listeners, go play around with that index. You'll see Finland, Norway had policies in their index, like they were in the 30s, right? Those are some of the lowest rates you'll see in all of Europe. So my theory is these countries looked at Sweden's policy and said, well, everybody over here, life's still going on pretty normal. And they're not having, these mass amounts of deaths like we were told. Again, we were projected. The modelers told us 100,000 people were going to die. Well, that's clearly not happening over here. And they adopted policies that were similar to Sweden's. So you bring that point up to people who, I think they kind of sputter around. They don't have a real good response to that. The truth is, these other Nordic countries, these Scandinavian countries, had policies that were much closer to Sweden's and different.
Okay, so as the pandemic rolls on, the other Nordic countries kind of move towards Sweden. But isn't it also true that as of December 2020, that Sweden started implementing more restrictive policies, strongly suggesting masks if they didn't outright mandate them? I can't quite remember. And they started limiting gatherings more, and ultimately they had vaccine passports in Sweden. So how do we know that as those other countries went toward Sweden and Sweden went toward those other countries, they didn't sort of hit a equilibrium point where, okay, we're at about the same place now, and then the numbers kind of level out and become more commensurate?
Yeah, no, I think you make a good point. Like this is something that I talk about in my article, and Wallace Wells talks about. Sweden became a highly, because they skipped lockdowns entirely. But this shouldn't, people should understand. Like I just mentioned, it wasn't like they had the most laissez-faire policy in the world. And as you point out, like later on, because of political pressure, let's not forget, Anders Tegnell, who was the architect of Sweden's policy, was getting death threats. Like people were trying to get him fired, all this stuff. There was massive pressure on Sweden to adopt approaches that were a little bit more in line with other countries. And they did some of that. You look at these things, you can crunch the numbers. The biggest problem people make with these things is again, they want to focus just solely on COVID deaths and things like this. We saw quickly that's a mistake. You can't focus on just this one sliver of thing and neglect to look at this huge other picture, which is why I like to look at excess mortality data instead of just COVID mortality, because there was a great article we had on this early in the pandemic. You can't save lives; you can only trade lives. And when you make interventions of this kind, you are costing, the lives in other places are lost, right? It can be, we saw the World Bank data over this, how global poverty, extreme poverty surged when we did all these things. We'll be looking, trying to figure out for the next decade how many people were pushed into poverty and how many people, are going to starve because of this. You had suicide rates, you had drug abuse, you had alcohol abuse. All these things play a role. And, if we focus just on COVID mortality, but the truth is, I do think you can look at COVID mortality and look at these policies and say, you know what? These didn't really do what we thought they were going to do. And if you look, epidemiologists have been talking about this for decades and decades and decades. And we've had other highly, deadly and contagious, respiratory viruses. And society always decided, no, we can't do that. It's going to be worse. This time we tried something else. And I think we had the worst of both worlds because we didn't protect many lives. And again, I think there was a way to protect people. I think if you look at like the signers of the Great Barrington Declaration said we can focus on people who are actually the most vulnerable to this virus, right? And try to make sure we have sensible policies and recommendations in place to help them. But we didn't take that approach. We took this approach where, children who are all but impervious to COVID, we're going to shut down their lives, uproot their lives as well. We weren't discriminating at all on age when that doesn't make a lot of sense. So I think, we will look back and say the policies we took were catastrophic, because not only did they, protect very few people, it caused all this collateral damage. And that's, I think, a lesson we need to have. You can't just have infectious disease experts involved in these policies. They're part of the conversations, but you need economists, you need ethicists, right? You need other people that can say, well, is it really the right thing to do to make someone take a vaccine?
Psychologists too, right? Mental health.
Psychologists. Yes, absolutely. You need to have more conversation. The problem is they didn't want to have those conversations. They did not want those conversations. They wanted to set up the rules and have people follow the rules. And if you didn't follow the rules, they were going to bring down, hell and thunder on you. And I think that's, we need to be very careful. To me, you look at what happened, it's obvious. Central planners don't have the knowledge to control this, vast system in a way that makes sense. The central planners, they're really good at coming up with a plan. They're really good at enforcing their plan. But when it comes to that plan executing in a way that actually makes sense, no. And we can't make economies run, because we know how complex it is to try to centrally plan them. So this is why I think a lot of libertarians, not enough libertarians, sadly, but why more libertarians got this right than others, because libertarians have a suspicion of central planning. Where we say, well, it's really hard. Economies are complex, and a virus is no different. Like the idea of just having people social distance or wear a mask while they walk into a restaurant and then take it. All of these things, they don't make sense. Even the lockdowns didn't make sense, right? Because the hardware stores right here is closed down. Guess what? The liquor store is open. Why weren't liquor stores closed? I'll give you a real question. Why weren't, it's funny. Some people aren't even aware of this. You're like, no, liquor stores didn't remain open. I'm like, what planet are you on? Of course they did. In fact, I'm not sure you can find one state that shut down liquor stores, but it's a real question. Why do you think liquor stores weren't shut down?
If I had a guess, I'd guess they had a strong lobby, but I really have I have no definitive answer, but I think they probably had a strong lobby to stay open.
They got a decent lobby. I would say politicians did not want to fight that battle, right? People are going to go down into lockdown a lot easier if they have their beer. You take away their beer, you take away their booze, that's a different story. That was so my point is, politics dictated that. Politicians, I want to say, were smart enough. They were smart enough, because they knew their policy would go down easier if people had their beer and their booze.
It was chased with a Jack and Coke.
Exactly. You take that away, and you were going to have a bunch of pissed off people, and there was going to be a lot more uproar.
So it sounds to me like what you're describing is like a Hayekian knowledge problem, where there's so many new moving parts to a society that any central committee or board that you put together that tries to sort of regulate it all simply doesn't have the information and can't have the information. And you don't know ultimately how people are going to respond. Like, you can mandate, for instance, and say, well, you have to wear a mask. But then what about the people that are going to rebel against that? People who may have, if you suggested it, said, oh, maybe it's a good idea to wear a mask. But when you mandate it, say, oh, I'm not wearing a goddamn mask. And there's all types of phenomena like that that can take a different road than what these experts think it's going to take, right?
Great point. And I'll say, like, even put the rebellion part aside, you have a more I don't want to say more benign, but a different social implication, right? People are wearing a mask. Guess what? They suddenly think they're protected, and they're going to be interacting more. We saw this. I tweeted this a few years ago. It was a bunch of CNN reporters, and it's back in April 2020, and they were kind of doing their virtue signal. They all had their mask on, and they're all huddled together for a selfie, and their faces are touching almost in their masks. I'm like, we're in the middle of a pandemic, and they're wearing masks. They think clearly, like, oh, I have a mask on, I'm safe. Well, guess what? like if these masks aren't fitted properly, they're going to offer you no protection. And I think that photo offered a great illustration of this. Like people, when they wear masks, they're gonna be interacting more. They're gonna huddle more. And that's just natural because we feel we're protected. And I published an article today on FEE. If anybody listening can go check it out. It was, I hate to always go back to the pandemic stuff, but I did. It was on masking, and there was 2 studies came out, one in the UK and a different one in Frontiers of Health. And one study showed all the harms associated with masking. Okay, it was a meta-analysis that looked at thousands of studies. Turns out, like, there are all these harms that are associated with masking, and they're not surprising. Labored breathing, higher heart rate. There's a dozen things that health implication for younger guys or people your age, my age. Maybe they're not a big deal. Older people, these are real health consequences. And a different study came out days later, and it was at a UK hospital, one of the largest hospitals in the UK. And they looked at their hospital for 10 months, and they measured COVID transmission in the hospital with the mandate masks and without, and there was no difference. No difference at all.
It's funny.
Their own conclusion is there's no discernible impact in our policy. And so what we have are 2 studies that come out. One shows there are clear harms. Okay, clear harms. The other one shows there's no discernible impact for this policy. So I think you couldn't say those things in 2020 because it was an uproar. Like, you want to get people killed. Now we have more and more science coming out on this, and I think the record will be clear. I think, more and more people in public health will come forward and say, yeah, we got it wrong. We really need to learn from this. Dr. Fauci won't.
No, I doubt he will.
He's never going to come around. But I don't, that's okay. He can stick to his guns. I just want other, medical professionals and health professionals to be able to say, you know what? Yeah, we made mistakes. We need to learn, from these and do better next time.
It just occurred to me in regard to some of the risks of mask mandates. A few months ago, I went to take my driver's test, and it was mandated that I wear a mask when the instructor's in the car with me, but I wear glasses. So what ends up happening now, I got this mask over my face and my glasses are steaming. So you want to protect this guy because I might have COVID. Meanwhile, I'm driving a car with my glasses fogged up. And I mean, when you iterate that across a society, that type of thing and that type of collateral consequence that you're not anticipating, and you can have a lot of risks that are being assumed.
That's just it. We can't even think of all the trade-offs for that policy, right? Is it protecting people a little bit? Some people think yes. I tend not to. But we know like there are all these consequences, speech impediments, right? Learning is inhibited with these things. Acne, like some of these things, people like, wait, they'll brush off. But wait until your kid has a speech impediment or is suddenly can't, struggling with learning, or if your child's deaf and needs to read lips and suddenly can't. These are serious things, and people just want to brush those things aside. And again, I'm not going to tell people how to live their lives. If you want to mask, go ahead. I had a friend that was masking before any mandates, and he's a really smart guy. He's a person whose opinions I respect, and he believed it was going to help, and him and his family were masking like crazy. And I didn't think he was an idiot for it. I didn't think he was a fool. I was like, oh, okay, maybe he knows something I don't. I don't know. If you want to mask, okay, but when you start to force other people, it's a problem, and it comes with all kinds of social problems. We saw I don't remember if you remember this one, but a woman was walking through the subway and her mask was too low, and the police started to talk to her, and she just kept walking. Well, they finally grabbed her, and she resists that much, and then she's body slammed. She's body slammed by police in front of her children, right? This isn't the way to construct society with force in this way. If you don't do what we tell you, we're gonna arrest you. We're gonna shut you down. We really need to rethink this. And I think that this is one of the things, again, why libertarians were able to think about this on different lines and see through. There's a knowledge problem, but there's also just this idea. I think we instinctively understand that force is not the way to build a society, right? Voluntary action is a good way to kind of harnessing that, using good, healthy incentives. That's the way to to do things. But I think there is growing, like people look at government. They know what they're doing. They'll come up with a plan, follow it, and just get on board. And I think that was one of the things that really frightened me in this pandemic, is just how people were just like, oh, well, of course we're going to listen. Of course we're going to, and we're not going to, no, don't debate it. We don't care. You got to listen. You got to get in line on these things. And that's seeing that, that wasn't the America I remember, growing up, right? Like and I think we've become much too comfortable with government. I think we need to learn some lessons that government isn't a force that actually is good at achieving anything. It's a necessary evil. And when you try to use it, in constructive ways to do good, it's going to backfire, every time.
So what about the idea that Sweden has a vastly different culture than what we have? So, for instance, if you just leave it up to, like you said, voluntary associations, they're a more respectful society. Maybe they are more community oriented. So they would voluntarily perhaps take the type of measures that Americans wouldn't take if we weren't forced into doing it. Is there anything to that line of thought?
Well, here's the thing. I think, who gets to assess risk, right? I think if you go back in early March, even before there was lockdowns, I remember we drove to Wisconsin. We live in Minnesota. We drove to Wisconsin. There was not a car on the road. It was a ghost town, right? And you'd go to the gas station, not a soul inside. And I remember, I don't think I was wearing masks, but I think I might have had gloves on. And again, it's kind of, but I'm like, you know what? We had plans to go. We're going to go. And I made a choice. I'm like, there's this virus going around. This is right before I think it was after this weekend is when lockdowns came down. And, but I'm like, you know what? we're going to, live our life. Well, is there a risk? Yeah, there's always risk. There's a risk driving across the country. So you assess those risks and you make a choice. A lot of people looked at assess that risk and what they do. They didn't make my choice. They said, you know what? There's a deadly virus going around. I'm going to just kind of chill out. I'm not going to go outside. And when we got to my buddy's house in Appleton, Wisconsin, we went out for dinner and restaurants were pretty empty. And nobody really knew what was coming, but individuals are assessing risk. Right. And here's the thing. If this virus had been worse than what it was, you would have had people that are going to be like, oh no, I'm not going, but the truth was, we've seen viruses like this before. It's very similar to the H1N1 of you go back in the late 50s and you ask if you look the fatality rate of that virus, very similar to COVID. Ask people who lived, back then, if they remember that. They don't even remember going through that, even though you had tens and tens and tens of thousands of people that died, if not hundreds of thousands. I forget the exact, it was hundreds of thousands, and it was a much smaller population then. All these people died, but they kind of went on with their lives. They were assessing that risk, right? And there was even back then, there were some schools that were shut down. But I think people will assess risk. And this idea that Americans are going to be like more freewheeling and crazy than people in Sweden, I don't really buy that. And again, I think you can work, we saw this, you can have public health departments that give recommendations to people and say, you know what, we think large gatherings are really dangerous right now. We're going to, people will listen to that. And then they're going to see how dangerous is it? We saw it with like Sturgis back in 2020. They didn't know if they should shut it down or not. They ended up having it. And some people claimed it was a super spreader event. At the same time, you have other people that are going back for football games. Again, people are going to make these assessments. And I think the biggest lesson is the virus is going to virus. And, I think this idea that it's within the power of, people in Washington, D.C. or the state capitol to come up with the right, way to, we have to understand that this virus is going to be going around. And I think it's just reflective of simple sanity and humility to say, guess what? We're going to offer recommendations, but this is a serious thing, and take precautions, instead of pretending like you have all this knowledge. And that was the problem. They were pretending, you mentioned Hayek, it's the pretense of knowledge, right? We're pretending we have all this knowledge. They don't. And you can see it in the results of their policies. They didn't have the knowledge, but they were pretending they did, and they were pretending to orchestrate, engineer society in this way that was going to be effective and safe. It was really a charade.
The fatal conceit, right?
The fatal conceit.
So this, I'd like to get your take on something, and it's a little bit, it has to do with COVID, but it's off of Sweden. How it's very difficult to make decisions in a society where, on one hand, you had your Fauci's and your government bureaucrats telling you, lockdown, it's the only way, you got to wear masks or everybody's going to die. I mean, that's obviously hyperbole, but nonetheless, we're going to have these high death rates. This is the very serious virus. But then on the other hand, we had people saying the virus isn't even serious. It's just a common cold, or, take hydroxychloroquine or zinc and you're going to cure it. And Trump said, we're going to have this over by Easter. And then he said, well, maybe we could, inject some disinfectant. And plus, Trump, look, the guy's a liar. And I think most
He's a politician.
Yeah, well, I was going to say most politicians are liars, but he's far more brazen in his misstatements than what they are. So when he would say something, if I don't have direct knowledge of it, my inclination was to disbelieve what he was saying. But I found myself just not knowing. It gets to the point, it's like, well, who the hell knows? Is there any way to solve that? How do we get around that sort of, where you have one side says one thing, the other side just says the complete opposite, and both sides have their sort of information machines that will pump out what they want people to think, and the people choose to go to the information systems that are going to tell them what they think. What are your thoughts on that? I mean, I know that's not what you came on to discuss, but I just figured I'd ask you now that you're here.
No, it's a good question. I don't mind jumping around topics a little bit. Yeah, I mean, your assessment of Trump, I think, is pretty good. And guess what? Trump was one of the most vocal critics of Sweden's policy. Just to
really
go back to that. Yes, he was very critical. I tweeted about it this morning. He was ripping Sweden on social media. He was ripping them in the press. Said they were getting all these people killed. Which again brings me back to your point. Trump was the worst president you could have had in something like this, because he has no discipline, right? He is somebody, when I talk about the pretense of knowledge, I mean, Trump does it all the time. He's just firing, just whatever he feels, he's just spouting out there. And if you would have had a president that kind of could have had the right people first, because like Fauci was not the right person, and Fauci's been there a long time, I get a little bit why Trump was afraid to fire Fauci, because that was going to be it was like firing Comey, right? Or something that's going to, there's going to be a lot of blowback for that, but it had to happen. But if Trump could have kept his mouth shut and had people like a Dr. Scott Atlas in there, this would have been a very different thing. And in fact, it might never have gotten so crazy, because if you think back, you talked about people saying, "Oh, the virus isn't going to be a big, blah blah blah." Trump was one of those, and it was downplaying the virus for a week or two. And finally, the press, you could see the press had enough, and they ramped up the fear machine, and they scared the hell out of people. And there was a tipping point finally, like, "Oh, this is gonna." You could see it. They got through. Americans are scared, and suddenly it's all hell's breaking loose. And that's kind of what precipitated this. If you go back, like swine flu, okay, people don't realize it. Swine flu, came, I don't remember, as 2009 and 2010 or whatever, under the Obama administration. Obama's administration was very smart. They didn't want this tracked, first of all, like the way we were tracking all the COVID stuff. But swine flu is more deadly to children than COVID. There's no question. It was a lot more deadly. But Obama was a cool customer, kind of was able to kind of like create, he was able to stop a panic, right? And if you go back the last 20 years, I don't know if you've seen that meme, but Time Magazine every year has, every year, every other year, like the next pandemic, the bird flu, and like each one. And this one finally took off, and it was, granted, it was a virus that was worse than a lot of the previous ones, but it didn't have to be what it was. Like I think, like even now you have people that were, Lena Wen at CNN, who's like, she's finally come around to saying things that we were all saying in 2020. She wrote something just recently for either CNN or the Washington Post, like, well, we're overcounting COVID deaths. She's like, what's going on here? Why are we doing this? Like there's incentives baked in to overcount COVID, right? Every hospital, when you tell hospitals like COVID deaths, you're going to get, all this extra money. Guess what? Suddenly you're going to have a lot more COVID, deaths. I had family members who died, like they were trying to put COVID on the sheet. Like, well, no, he didn't have COVID. What are you doing? They're like, oh, sorry. Okay. You're right. So yes, we are going to look back and we're going to realize like COVID was deadly, very deadly. I had it. I don't know. Have you had it, Michael?
Yes.
It was rough on me. I was pretty sick. I was down for days. So I don't want to minimize the virus. At the same time, all of this was inflated, and nothing more than the fear. And if you ask people, like, we've done some stuff at FIA on this, and Bill Maher later, I think, used some of our stuff and did a segment on it. It was great. If you look and just polled people on the fatality risk of COVID, you had progressives that thought it was like 50%. Like they thought if you get COVID, you're going to die. Like, yeah, it's really like they scared the hell out of people with this stuff. And I say I mean, mostly the public health bureaucracy and the media. And what else did they do? You asked about, what do we do to have these discussions? They kind of, we're going on that same vein. They said, well, we can't have these doctors over here are, these Great Barrington guys they're saying stuff that contradicts us. So we're going to sick reporters on them and try to smear them and try to, call them, like they're crazy guys from Harvard, guys from Stanford, from Oxford. That was what they said. We can't have all this information out there. We got to have one set of information. Well, it doesn't work that way. And, you brought up, alternative treatments like ivermectin, hydroxychloroquine, and all this. I have no idea if these are effective or not. Even media today, like, oh, unproven medicines. Well, guess what? Like that's sort of like, we don't know yet the best treatments. And, I think we're getting closer. But this idea that the media would freak out if you were offering other treatments that might have had, there were solid studies out there that suggested these might have been effective treatments. Well, they weren't random, blind random studies. And okay. But the truth is we didn't know. You don't go take a doctor's license for prescribing that. And that's what we saw, or getting them, like you did, you had physicians that lost their licenses, that were removed from boards and all this because they were offering other alternative treatments. And again, I don't know if I didn't take any of those things when I had COVID. Okay. But this presumption that, we have the knowledge, and if you stray from our remedies, we're going to punish you. That's really frightening to me. I don't think that, especially when, like I said, we're dealing with these treatments, whether it's vaccines or other things in real time. We don't know the best treatments, and you got to just kind of trust medical professionals in good faith. They're going to try to give what to their patients what they think is going to help them. And if there are adverse things, of course you need to we need to know about those things. But that doesn't just apply to, ivermectin. It also applies to vaccinations. And that was something that bothered me throughout the pandemic is you could not, talk about vaccine injuries. And it was something that I have an article coming out. It'll come out next week on the campaign of information, where even if you're sharing true information, they were going to remove it. because it was undermining their narrative. This is what we never would have known the extent of this if not for the Twitter files, right? But some, David Zweig, a good reporter, Matt Taibbi, or Taibbi, another great reporter. They've been talking about all these things, and this idea that they were going to censor information, even admitting it was true, but because it was going to increase, vaccine hesitancy and things like this. To me, that's like Orwellian. So I understand, like your question's good. Like we have all these, who do we believe? Because you're right. We have people out there saying like, oh, COVID's just a hoax. It doesn't really kill you. All this stuff. And then you have people out there, with this other message. Information, you got to let it flow, and you try to do your best to give good guidelines. But I think some of that was a reaction too, because you had, once the public health bureaucracy started to ramp up their own message and silence anybody that kind of said anything else, it fueled this conspiracy mindset, right? Yeah. And it was weird. Like it was like you had people that I'm like, no, like. I had, like people that would ask me like, oh, do you think I should get vaccinated? I'm like, well, I do. I mean, because you're in that age group. I said, but don't take it from me. Like, I'm not a doctor, ask your doctor. And, but like, they weren't afraid they were going to get microchipped, but like there was all these things flying around, and I'm like, people kind of just need to, try to find information you trust, try to ask a lot of people, and then make what you think is an educated decision. But don't rely on Fox News, don't rely on CNN, don't rely on Anthony Fauci. Again, that's my advice. Pick people that you think you can trust and that might not have an agenda. That just, and try to find voices that, weigh some information, excuse me, against other information, and just make the best educated decision you can.
One of the most interesting dynamics of the politics of this thing, I remember when Dr. Fauci said that masks won't help. We don't need to be wearing masks. And then later he admitted, well, I said that because I didn't want to create a panic. And conservatives were up in arms that he would be giving out misinformation like that, even if it was to prevent the panic. On the left, they had nothing to say about it. There was no real criticisms. Not that I remember, because I'm sure somebody will point out, well, what about this guy? But it wasn't vociferous. It wasn't like the conservative backlash to it. And then later on, it came out in the Bob Woodward interview that Trump, he said, well, he downplayed it at the beginning because he didn't want people to panic. Now the left was up in arms that Trump would lie, and conservatives were saying, well, he wanted to prevent a panic. And you can't, I don't want to say survive because that'd be a bit much, but I don't know how we function when that's the response, when people just respond based on who's saying something and not on what's said. If my guy lies, it's okay. If your guy lies, it's the end of the world. So I got one more question for you before I let you go.
Let me just make one point real quick on that.
Go ahead. Yeah.
So, because you're right about Fauci, and this is something though I looked at as well. He did say, later on, well, I said that because I didn't want to cause a panic. But if you look, we have emails too. And he was saying this not just publicly, he was saying it privately. And to me, that says Fauci actually believed this. Like these were personal friends. Okay. And Fauci was saying, you know what, wearing a mask is really not going to help you. And just giving advice to someone. So to me, that if it's a private correspondence and you're offering that advice, to me, I think Fauci actually believed, like, you know what, like, because he was, let's be clear, he was saying the same thing as the World Health Organization, same thing as the Surgeon General. For years, we've said, you know what, masks are a pretty bad way, pretty poor, ineffective way to reduce transmission. So.
Yeah,
I'll kick it back to you with that. But
yeah, that's a good point. I didn't know there was private emails. I'm glad you brought that to our attention. That's excellent. So my question is this. Say a year from now, pandemic hits, another pandemic, and the government, same scenario. You got to do this. You got to wear masks, lockdown. Will people go for this again? Do you think?
No,
you don't think
I don't
so?
think so. Not right now. Again, it depends. It depends on a lot of things. Look, I think a lot of this was driven. I kind of made this point earlier by the fact that we were kind of it was everything was so loony. You had Trump running for re-election. The media despised Trump with something that we've never seen in our lifetime. And I think all of that kind of lended itself to this overreaction. And I don't think here's what I would say. The next crisis is going to be a different crisis, but so we're not going to overreact to this one this time. If we had another pandemic, we're not going to go into this. We're going to learn some of that lesson, but there's going to be a different crisis. I don't know what it is, but we're going to struggle the same way, and it's going to be, central planning. It's going to be bureaucratic, and we're going to have some of the same failings in that. Don't know, like that, but that's just sort of me. If I don't know, do you read Robert Higgs at all? He's the author of
only on the Great Depression and coming out of
Crisis of Leviathan is one of his books. And, I think Higgs makes the thesis of the book is, we have all these crises, and it's sort of like that's when you have massive encroachment of government and civil liberties, and because that's when government grows, and you have this ratchet effect. Government gets all its power, then it gives a little back, but not all of it. And I think what we're seeing now is that we just have crises that are manufactured, and I don't mean manufactured in that they're not real. COVID was real. 9/11 was real, right? Like 9/11, but it was still, we took a crisis and blew it up something way beyond what it should have been. And so the next crisis, we're going to overreact to that one too. And it's going to be all hands on deck, a massive government, intervention and growth on this huge scale. And so that's my fear. We're going to see another crisis. Whether it's a bank crisis, right? Like, oh my gosh, maybe we're seeing it already. You look at SVB, and already like the government's overreacting to that, saying, "Oh, we're gonna have all these, deposits, not just the people that are. We're going to guarantee those not just up to $250,000, but we're going to guarantee them all." Well, what's that going to do, right? What's the moral hazard there? I don't think it's hard to see. You could see this massive consolidation of banking, and what's that going to do? Like, it's going to, so whatever the next crisis is, get ready for an overreaction, and it's going to be, the response is always the same: more government, right? Whatever the crisis is, that the response is going to be, oh, we need government to get all in this huge, massive, the war on whatever, the war on COVID, the war on terror, the war on fill in the blank. And you're going to have some dissenting voices out there like myself and Fee and others in the libertarian community saying, this is not the way. And hopefully they'll listen, because our track record on this stuff is pretty good. Whether it's the war on terror or COVID or whatever, like once you start to recognize this pattern, you can spot this stuff and argue against it. But getting people to listen is hard. And I talked to somebody, a great author the other day. He was a libertarian. He said, "Oh, libertarians suck at marketing."
They
and
do.
I think he was on to, we get the ideas right, but marketing, we don't really get that. And just trying to get our voices heard. I think we're getting better. I think we're improving. But the truth is, it's the same thing. I've said for years, like libertarians, we're not good at journalism, right? Like there's some you can count on your hand how many the great libertarian journalists. On the left, they have tons of good journalists, tons of great outlets to write for. Libertarians aren't as good at that, and it makes it harder to get our message out there. But I think we're having some success. Like I think Fee's been having success. I think other libertarian organizations. I was disappointed in 2020 that more didn't really take a strong stance on COVID. Like it's something I think some did eventually, right? A lot of them, like by 2021 or 22, like they had found their voice. But I think we need to get better at that. And some of it's just courage, right? Like I get it. Some of our ideas, all this runs, our ideas aren't popular overall, but then inside the beltway, that especially like they're kind of sneered at, but we can't let that. The principles are principles; they're right, and we need to champion those principles, even when it's not popular to do so.
Spot on. So before you go, is there anything else? Did we miss anything? Anything you want to add?
No, not really. Like if readers, I mentioned Feel a lot. I have a Substack too. It's under like JJ at gmail.com on Substack, and it's called The Take. So if anybody listening like wants to check out my writing there, I publish every day. And it's something like I just enjoy. It's a place where I can get my message. It's mostly libertarian stuff, but sometimes I wade more into culture or music or movies and that stuff too. But that's my platform. I'm trying to grow it. I'm trying to get 1,000 subscribers, and I've only had it for a few months now, but it's grown pretty good. So check out that. Other than that, I appreciate the invitation to come on your show and talk with you about all this stuff.
Well, thank you. I'd love to have you back because you're very informative. All right. For now, I'm Michael Liebowitz. This is the Rational Egoist. Remember, like, share, subscribe, and we'd love to hear your comments, feedback. Please let us know. Have a good day.